This is a case of appendectomy in a young 22-year-old man, and he has a acute appendicitis already diagnosed by physician somewhere, and the physician has advised the surgery. So we are performing the laparoscopic appendectomy here. Inferior crease of umbilicus we are using, and we will put the telescope, and we will use micro alligator so that there will be absolutely no scar. And we are introducing various needles through the inferior crease of umbilicus, and you will get two click sound, and because it is a disposable various needle, so we will get the green color once it enter inside the abdominal cavity. And here we have the syringe, and we will do suction irrigation and hanging drop test to make it sure that we are inside the abdominal cavity. And we can see aspiration is taking only bubble, and there is a ball in this ethicon disposable various needle. That ball will sink down. Once you will open, you can see this ball is sinking down. That means you are absolutely inside the abdominal cavity, because negative pressure of the abdominal cavity will sink down the ball. So that is a good indicator. Now we are attaching the insufflator, and we will start. Here we have kept the preset pressure at 15 and the flow rate at 1 liter per minute. So slowly the abdomen is distending. You can see the homogeneous distension, and now slowly the actual pressure is reaching to the preset pressure. So at this we will put the first trocar, that is for telescope, that is the optical port, and we will use the one on the left iliac fossa. And one on the right hypochondrium, we will use just the striker mini alligator. Mini alligators has an advantage that you don't need any port. It directly go percutaneously, and it doesn't leave any scar. It will be absolutely scarless, just like a needle. When you prick a needle somewhere, you are not getting any scar. So same way we will perform. Now here access we are doing by a Scandinavian technique. So the initial this incision will be enlarged, and we are using the elbow number knife to make a smiling incision, that is a U-shaped incision over the inferior crease, so that it will completely hide. Another advantage is you can dilate the obliterated vitreointestinal tract, so that will have the valve action, and absolutely there will be no chances of hernia. So this is the dilatation of the obliterated vitreointestinal tract over the inferior crease of, and this concept was published by the Scandinavian surgeon. So that is called a Scandinavian technique. Now we are using trocar, and we have a lot of betadine over the tip of the trocar. Publication of one of Indian doctor, you can search on the Google, that putting betadine at the time of introduction of the trocar over the tip of the trocar will prevent a lot of infection. And index finger is pointing for, and middle finger is around the air inlet, and there is a hissing sound. You can hear this sound. And now we are inside the abdomen. After that, telescope will be introduced, and we have seen little adhesion over the medial umbilical ligament of the right side, and appendix is quite inflamed. However, it doesn't have any lump. So we are putting the another port on the left iliac fossa, that is just a 5 mm port, and later we will use 5 mm telescope, and we will remove the appendix through the umbilical port, because for removal 10 mm is required. So this is the another port, and then we will go with the striker mini alligator on the right hypochondrium, low right hypochondrium. So this is just a 1 millimeter, a small nick on the skin, that's all, even invisible. And now this striker mini alligator will be percutaneously, it will be introduced. You don't need any port, and it has a self-retaining atraumatic grasper mechanism, and that grasper comes from the needle itself. So we are putting it in, and then we will hold the appendix with. So we are using this type of graspers, alligators, micro alligators for the surgery to decrease the number of the ports and to perform a scarless surgery. Many companies are making mini alligator. A Striker is one American company that makes the best alligator, and these are the micro laparoscopic instrument which doesn't need trocar, and directly it can enter, and you can perform the surgery. So this is what we are using in this surgery. So it is already been introduced, and after that this will be held by one of your assistant, and the camera person can hold it, and now we will show you the inside video how to perform surgery. So this is the striker which came out, and it is self-retaining, so it will has a spring mechanism which is holding the appendix. You can see this is a quite long appendix and little inflamed. However, it is in catarrhal stage right now. So after cutting the appendix shrinks. So whatever you are seeing the size right now, once you will remove it from inside the abdomen, it won't be shown that much big. And we are removing in the entire major appendix as near as possible to the appendix, because after that removal of the appendix will be easy. So we are using here harmonic scalpel, that is ultrasonic device, and it is not a current, it's a vibration, it's a ultrasonic technology. And as you already know, that advantage is that there will be no burn, no chances of remote injury, no collateral damage, no bleeding, and you can have a very good dissection up to the base of the appendix. And we have reached up to the base. How you will identify? See, tinea coli. We have reached up to the tinea coli here. So this is appendix and this is cecum, and our dissection is reached up to tinea coli. So it is important to reach to the base completely at the level of cecum, so that there will be no incomplete appendectomy. So entire major appendix is separated, and now we will tie the Mishra's knot. Mishra's knot is one of the best knot, that is a extracorporeal knot to tie. So I will show you how to tie this knot outside. So configuration of this knot is 1 1 1 1 1 1. So this is the single hitch, and this is the first wind, and this is first lock. This is first lock. Now this is the second wind, and this is second lock. Now you will have last wind, and this is last lock. It's a very secure knot up to the, you know, fifth, this 18 mm structure you can use it. Up to 18 mm structure, like even pedunculated myoma, or even in cases of appendectomy, renal artery, splenic artery, all. Now this striker mini alligator is dropping the appendix and going through the loop of this Mishra's knot, and after that you can catch it, and then again you can slide the knot and keep the tip of the knot pusher over the cecum on the base of the appendix, and here this knot is tightened, and it gives you very nice dumbbell formation, absolutely very good. And then you can cut it with the harmonic, and harmonic has the advantage that it will seal. With the harmonic you may do clipless appendectomy also, especially in pediatric. It is published already, you can find out in the Google, but here we always in adult we prefer to tie a knot, and that's over. You can see now we are using claw forceps and 5 mm telescope we are putting in the left iliac fossa, 5 mm telescope, and appendix is taken out through the umbilical port, hiding completely into the cannula, so that it will not contaminate the abdominal wall. So it should be fully hidden in the cannula, and everything is taken together. So this is over, and now this is the removed appendix. So thank you very much for watching this video. Have a nice day.